Why don't you tell the viewers a little bit about yourselves, like your name, your background, what brought you to CSPL, things like that?
Hi, my name is Jeriann Collymore. I'm originally from Brooklyn, New York. My entire family's from the Caribbean. So I'm a first generation American. Um, I am a first year medical student at Loyola Stritch School of Medicine, but I'm in the dual degree program, the MD and PH program. So I also am receiving my master's in public health. And the reason why I am attracted to public health is because I believe there is a lot of factors outside of the hospital that needs to be addressed in order to completely um, improve the health of an individual, such as like our lifestyle habits, the environment, things like that. And what brought me to CSPL is that it is a very valuable grassroots organization um, full of motivated individuals working towards things like improving the number of people counted in the census, and also fighting for immigration rights. And I think those are issues that we often are aware of, but we never actually just work towards a solution in terms of that. And so I think it's important to be connected with people who are making a difference in the community. And so that's what brought me here.
Hi, I'm Jess, and I'm also, as like Jeriann, I'm part of the MD MPH program at Loyola. So I'm a first year medical student and also part of the Masters in Public Health. So a little bit about my background. I actually grew up in Mexico, and one of the reasons that I'm interested in health disparities and public health in general is because I grew up in a very medically underserved area, so we didn't have a lot of doctors. So like I grew up seeing a lot of people sometimes just be sick and not be able to go to the doctor. And that was something that I grew up thinking about. Like, how is it possible that some people have access to care and some people don't? So that was just kind of something that I would think about all the time. But then later on, as an immigrant, so I moved to the United States 10 years ago with my family. And then this idea of disparities in healthcare just took a whole other different dimension in the way that it wasn't all just about poverty or lack of resources, lack of access. It was differential lack of access. So seeing a lot of just not even access, but more lack of quality care for per se people of color or people who don't speak the language. So that's just something that made me very passionate about inequalities in healthcare and about how there are other factors, more systematic and social determinants that affect the way that people live and how healthy they are. And so that's the reason I decided to be a part of the public health program. And so I did global health and health equity. So we talked a lot of those um, social determinants of health, and that just that idea and passion to try to think about what is it about society that affects healthcare and people is something that drew me to CSPL because of the mission to try to improve the quality of life of the people who are marginalized in our society. So like for immigrants, I like that they put a lot of efforts into immigrants' right and also improving just the quality of life of people in general. So for the census efforts that Jeriann talked about, I'm very I'm very passionate about this, and my mission kind of aligns with CSPL's mission, which is to try to provide equality to everyone.
Awesome. So, in general, why do you think it's important for people to engage in Census 2020 and participate in Census 2020?
Well, to my knowledge, for every person that's counted, there's a certain amount of funding that is incorporated back into the community. And so it's important for everyone to be educated um, on the census in general, but also to actually be counted. And so I think that one of the biggest issues in communities, especially um, the marginalized communities, is that there isn't an equal distribution of resources and money. And so hopefully the goal is that if everyone is counted, that some of that money can be invested back into the community, and hopefully it can go towards the education or towards the environment, um, and things like that.
Yeah, so same as Jerry, and I also agree that making sure that everybody is counted is something that matters a lot in terms of how we distribute resources from the government. So nationally distribute into towns and communities based on how much they deserve. So so the reason I'm interested about helping out with the census with CSPL is because, like Jeriann said, from what we know now with our involvement with CSPL is, for the past 10 years, Maywood, especially Maywood, the communities that have a very high community, they have a very high number of immigrants or people of color are less informed about how important it is for the census to include everybody. So, in one of the myths that we know is, or a lot of immigrants per se don't contribute to the census because they believe that their information is going to be taken up into immigration departments, and that's not true. So, a part of the reason that I want to be involved in this is to make sure everybody knows that being a part of the census is something that's very important, and it doesn't really hurt you in ways that you think it does, and it does help contribute to the equality that we're talking about. So if everybody's counted, then those communities will get the amount of resources they need so that the families and people within that community are able to get the help they deserve financially and just, like she was saying, educationally, through health, and just in the community, better food sources. So even just like sanitation, things that would really help the community health-wise, but also just in quality of life.
Yeah. So if you look at through the lens of public health, like, why do you think that? Because we talked about it a little bit in general, but I know you guys kind of hit on it. But like in terms of like, if you look at through the lens of public health, like, why do you think it's important for people to participate in the census? Like, how does that play in the role of like increasing like public health efforts that you guys are like learning how to do at school, kind of thing?
Yeah, so public health is something that takes into account the health of the whole community. So it's not just like for us in as MD students, so we focus on one patient at a time, but then as a public health provider, you focus on population-wide health. So in the way that the census would help is if everybody's counted and then this community is getting the amount of resources they need based on how many people they have, because the census literally affects how much funding the community gets for the next 10 years. So if there's more funding in that area, that means that there's more public financial resources available for education, for clean parks, for even other, so even just sanitation, like that's a big contributor to health because infectious disease is very interconnected with sanitation and how clean things are, and also just the amount of good food resources they have also, because the healthier the diet is in a community, the healthier the people will be and the less likely they're to get sick. And yeah, so what do you think about that?
Yeah, so just to add on to that, I can only think of also to just increased resources could also lead to like maybe increased programs that can possibly help keep children busy after school, whether that's improving their academic performance or just less likely to get in trouble because they have a safe space to go to, or just also funding can go towards like intervention programs that can help increase health, I guess health, what am I trying to say? Like health outcomes, sorry. Okay, so like increased funding can lead to an intervention program such as maybe like providing like a doula, which can help moms delivering their first babies.
Yeah, and also something I just thought about, if we have better school systems because the teachers are paid better, or because we have, like she was saying, after school programs, or you have more individualized attention in specific kids, then they grow up with a better level of education that is not just affecting the quality of jobs they get in the future and subsequently their income. It's also going to make them more aware of their health. So health competency or health literacy is very highly correlated with education that a person has. So if we have a good school system because of the good fundings we have in the community, then the kids are more likely to grow up knowing more about the types of behaviors that will keep them healthy, such as exercising, eating healthy, just different things about addiction. Addiction is a big problem now. So if the school system is better in the way that it's providing students with information that they need to be able to take autonomous decisions on their behavior later in life to be healthier, I think that so in that way, the census funding could help create better school systems, which can then lead to kids being able to be more informed about their health in the future.
So any final thoughts or things that you want to add to the conversation?
I wanted to talk a little bit more about the immigration status thing in the census. So I know that one of the biggest fears for immigrant communities, and I know this because I'm an immigrant, so a lot of my family members are DACA or just undocumented, and I think one of the biggest myths is that if you fill out the census that you will not, or you will be at risk of having your information be dispersed to the government and then subsequently be arrested or deported, and that is a big misconception. The people that fill out the census are not going to make their information available to everyone, not even the people that manage the census. No, they don't have access to it. It's information that goes specifically to whoever is delivering the census, which has nothing to do with ICE. So that's why I just want to encourage everybody to fill it out regardless of, per se, documentation status or just any other fears that you might have about your information being public, because it's not. And then in the long term, you being counted within your community will actually be a lot better in the long run, because your community will get the money that you deserve as a citizen of your community, and then that money can be used to improve your community, your schools, your public parks, and everything. So I really encourage everyone to fill out the census.